we are going to talk about the cranial nerves. We know that the first two cranial nerves, namely the olfactory and the optic, start from the cerebrum. The third and the fourth from the midbrain, the fifth, sixth and the seventh from the pons, the rest from the medulla. Something special about the 11th cranial nerve or the accessory is that it has a spinal root as well. So, the first two from the cerebrum, the second two from the midbrain, the third three from the pons, the fourth five from the medulla. Out of these, we know that the first olfactory for smell, second optic for vision, eighth the vestibulocochlear for hearing and balance are all sensory only cranial nerves. And we also know that the third, fourth and sixth for extraocular muscles, for extraocular muscle movements, the 11th accessory and the 12th hypoglossal are pure motor nuclei. We know that some of these cranial nerves will have a parasympathetic outflow. How does the parasympathetic supply come? You have the hypothalamus, you have the descending autonomic tracts which bring about the parasympathetic outflow. We also call it general visceral motor. You have the Edinger-Westphal of the third cranial nerve, superior salivatory and lacrimal for the seventh or the facial nerve, the inferior salivatory for the glossopharyngeal or the ninth, and the dorsal motor nucleus of the vagus for the vagus. If we think about the motor output, we know we call the fibers corticobulbar. As you know, the precentral gyrus is important for the motor supply. We call it the motor cortex. If we look at the motor cortex, you will see the representation of the body, and here you can see that the face or the parts that are supplied by the facial nerve, by the cranial nerves, are present in the inferior part of the motor cortex. And also note that it is on the lateral side. So this side is usually supplied by the middle cerebral artery. We call this the homunculus of the motor cortex. So actually I was showing you the wrong side. This side is the motor side, the premotor cortex, the prefrontal gyrus, the precentral gyrus. This is the postcentral gyrus, the sensory. Alright, so these fibers come from the inferior part of the precentral gyrus through the corona radiata, through the internal capsule, through the nucleus of the lower motor nerve to the cranial nerve. So this part is actually the cranial nerve nucleus. This is the cranial nerve. So this is the summary of the cranial nerves.